Hello, everyone, and welcome to today's office hours on the ESG-CV Notice. My name is Natalie Matthews, and I'm just going to spend a very brief moment talking about logistics and then turn things over to our team to get to the content I know we're all anxious for. So in terms of housekeeping, if you are having any audio issues, any trouble hearing the team throughout the webinar, I do encourage you to switch your audio connection over to the phone number that is listed on the screen. We will put that in the chat box in just a moment. But we found that the phone audio can be quite a bit clearer and more stable. I also want to be very clear that this event is being recorded, and both a copy of the recording, the slide deck, and the chat content that we collect today will all be posted to the HUD Exchange. Just do please give us a couple of business days, and we promise we will get that up there on the link that appears on the screen. All participants are going to remain muted for the duration of the webinar, but we absolutely anticipate getting and hope to get lots of questions and feedback from you all via the chat feature. So in order to find the chat feature on your screen, please look in your WebEx screen and you should see a row of icons. One of them will look just like a chat bubble. If you click on that, it'll open up the chat functionality for you. And again, please direct questions, feedback, everything through the chat functionality. When you are submitting those messages or questions via chat, please do take a moment to make sure that the messages go to everyone. It should default to everyone in the to bar that appears right above chat. If it does not default to that, just take a moment and click on the arrow all the way over to the right and scroll down, and you should see everyone just there. With that, I'm going to turn things over now to Norm Suchar from HUD's Office of Special Needs Assistance Programs. Norm?
Natalie, and welcome everyone. We're very pleased to finally have this notice out and to be able to talk about it. So I'm going to introduce our presenters, and we are just going to jump right into things. So from the Office of Special Needs Assistance Programs, the SNAPS office, you'll be hearing from me, Brett Esters, Marlisa Grogan, and Ebony Rankin. We'll also hear about some environmental requirements from Lauren Hayes. Also, somebody from one of our field offices is a Philadelphia field office. Mandy Wampler will be on the phone. Next slide, please. I want to frame up the conversation a little bit. And so I just wanted to make a few key points before we get into some of the details here. So CARES Act resources are designed and intended to prevent the spread of COVID and to reduce the harm caused by COVID. And one thing we've learned over the course of the epidemic is that the safest place for people to be during the epidemic is in housing. Well, I very much applaud the heroic efforts people have made to make congregate spaces and unsheltered locations safer and to limit the spread of COVID in those areas. There is no doubt that the safest place for people is in housing. And at the same time, COVID has shown us once again that we have immense racial disparities in our country. And one of our tasks as we implement the CARES Act funding, as we implement ESG coronavirus funding, and as we move forward in our work is how do we address those racial barriers or those barriers based on race, reduce those inequities, and address them in our systems, processes, and practices. At the same time, COVID has had a huge economic impact on our communities, job loss, housing instability, increased risk of homelessness. These factors are also more likely to impact racial minorities, especially Black and Indigenous people. So again, how can we use this funding to make sure we're not perpetuating and to actually close some of those disparities? And people most harmed by COVID, it's not just that the risk of spread is larger in congregate environments, but we know that people with certain health conditions, and including people who are elderly, people with respiratory conditions and such, are more at risk of COVID, of contracting COVID, and also more at risk of negative outcomes from COVID. We also know from a lot of CDC data that Black and Indigenous people, including those who are elderly or have other health problems, are more at risk for contracting COVID and more at risk from really bad outcomes, including dying from COVID. So we are committed to working with you on these issues and we very much wanted to just sort of put this front and center as part of this conversation because we know how important this is and how much work you've been doing in your communities to address racial equity. So moving on to the next slide, please. Our goals for today, we want to talk about the ESG-CV Notice, and we want to talk about how it affects both ESG-CV funding and how it affects your regular ESG funding. We're going to talk about a lot of different waivers and alternative requirements, and we're going to highlight some grant management requirements, including things related to obligation and expenditure deadlines, record keeping and documentation, ITIS, and environmental review. Along the way, we're going to try to do our best to explain sort of the purpose behind these requirements and the goals of the requirements. If you have questions, as Natalie mentioned, please go ahead and type them in the chat box. We will do our best to answer as many questions as we can. We won't get to all of them. Some of them we just don't know the answers to yet. Even as we were drafting the notice, we didn't sort of anticipate every single possible permutation of things, so we're still working on addressing some of those things. But we will do our best today, and we will continue answering questions in office hours calls. It's the first one, including tomorrow's call, and we're developing FAQs and other materials to help answer additional questions. So with that, I'm going to turn things over to Brett Esders, who's going to take us into the ESG notice and requirements and alternative requirements. Brett?
Great. Thank you, Norm. I'm going to walk us through some of how the notice applies, what it applies to, some of the important deadlines that are in the notice, as well as what we mean by prevent and prepare for and respond to coronavirus. So starting on this slide, the ESG-CV notice, it has a lot of alternatives and flexibilities that you don't normally find in the ESG program. Those flexibilities apply to all ESG-CV funds, and they apply to any annual ESG funds that are required to prevent, or that are used to prevent, prepare for, and respond to coronavirus. There are a couple spaces in the ESG notice where the activities are more limited than what you can normally do in the ESG program. Two come to mind for me. One is there is a limit on rental assistance payments to 12 months, and one is how long you can pay for emergency shelter. Those apply to your ESG-CV funds if you've submitted a substantial amendment after September 1st and the field office hasn't completed their review of it yet. So anything that was submitted and approved before September 1st, those limitations do not apply. So to kind of quickly sum up this slide, if you submitted your substantial amendment before September 1st, all the flexibilities in the ESG-CV notice apply. The limitations do not apply. You can continue carrying out what is allowed in the ESG program under those funds. For ESG-CV funds, if your substantial amendment isn't approved by the field office until after September 1st, then you can follow all the ESG requirements except for, and the flexibilities in the notice, but the limitations that are in the notice, they do apply to your funds. And then if you're using annual ESG to prevent, prepare for, or respond to coronavirus, you can use all of the waivers and flexibilities that are in the ESG-CV notice, which Ebony's going to talk about a little bit later, and none of the limitations that are in the notice apply to annual ESG funds. And then if you're using annual ESG funds just normally, not to prevent, prepare for, or respond to coronavirus, then nothing in the notice applies and you just follow normal ESG program requirements. And we're going to talk in a minute about how you document all of this so that you can keep straight and also make sure it's kept straight for monitoring purposes. Next slide, please. Okay, so we're going to walk through I'm going to walk you through the obligation deadlines now. We have included in the notice some flexibilities to obligation deadlines. And as Norm said, really we're looking to promote equity through the ESG-CV program. We know that Black and Indigenous people and people of color have been more impacted by COVID. They also experience higher rates of homelessness. And so one of the ways, and we've put out a bunch of documents so far for how to promote equity through ESG-CV funds, but one of the ways you can do that is you can identify subrecipients who represent the communities that are most impacted. And we realize that oftentimes these subrecipients haven't operated ESG funds before, and as a recipient, it might take you a little bit more time to find those subrecipients. So that's the reason that we've given some flexibility around the obligation deadlines. So normally states have 60 days. What we've said is you have up to 240 days from the date that you had signed the grant agreement to subgrant out funds to subrecipients if you're looking to find new subrecipients to promote equity through your ESG-CV program. You have one of the things the ESG notice also does is allow states to carry out activities directly. States have 180 days to obligate any dollars that they're going to carry out directly, and they can do this through a written designation through their own department. Metropolitan cities, urban counties, and territories, they normally have 180 days from the date that we sign the grant agreement to obligate dollars. They're going to have up to 240 days from the date that we sign the grant agreement to obligate funds. Next slide, please. And then here are the remainder of the important dates. So we've received a lot of questions in office hours, and we've said stay tuned about how far back you can go to reimbursing funds. So this shouldn't surprise you. This should sound fairly consistent. You can use ESG-CV funds to reimburse costs as of the date that you began preventing, preparing for, or responding to coronavirus. And you need to keep a note in your files about when that date was for you. That can be planning meetings, calendar invites, whenever you started planning locally. And that date has to be on or after January 21st, which is when we had the first reported case. We already talked about the obligation deadlines. One thing that's important to remember is that you have to, when you're taking advantage of those longer obligation deadlines, your program records need to describe the changes that you as the recipient plan to make to identify and select new subrecipients and why you need the longer time to do that. Otherwise, you're held to the traditional 60 and 180-day obligation deadlines. And then expenditure deadlines. All ESG-CV funds have to be expended by September 30th, 2022, and then we've implemented some tiers of expenditure goals to make sure that communities are spending the money quickly to prevent and prepare and respond to coronavirus. So you should have spent at least 20% of your award by September 30th, 2021, and if you haven't, we have left ourselves the ability to recapture up to 20% of your award. And by March 31st, 2022, we're hoping for you to expend at least 80% of your total award, and if not, we can recapture. Next slide, please. Okay, so through office hours, we've received a lot of questions about what it means to prevent, prepare for, and respond to coronavirus so that you can make sure that the costs that you're carrying out with ESG-CV dollars are eligible, because all ESG-CV dollars have to be related to preventing, preparing for, or responding to coronavirus. And you can also then figure out in your annual ESG money whether the activity is allowable to follow the flexibilities of the notice. So preventing coronavirus, those are activities designed to prevent the initial or further spread of the virus to people experiencing homelessness, people at risk of homelessness, recipient or subrecipient staff, or other shelter or housing residents. And the notice gives some examples. It includes PPE. It includes paying for non-congregate shelter options. It includes paying for hotels and motels that are used for isolation for people in housing, paying for hand washing stations that you can put in your encampments, and providing rapid rehousing or homelessness prevention assistance to people who are eligible to reduce their risk of contracting the virus or spreading it. Next slide, please. We've defined preparing for coronavirus as those activities that are carried out prior to or during the outbreak to plan to keep people healthy and to reduce the risk of exposure to coronavirus and or to avoid the slow spread or to slow the spread of the disease. And this is more about planning, updating your written standards to prioritize people who are at high risk of contracting coronavirus, adapting coordinated entry policies, developing strategies. This is going to be your system level stuff. Next slide, please. And then finally, we have responding to coronavirus, and we've defined this as activities that are carried out once coronavirus has spread, or once individuals or families lose or at risk of losing their housing as a result of the economic downturn caused by coronavirus. So this can include transporting people to medical appointments, paying for shelter to isolate individuals, or providing rental assistance through homelessness prevention or rapid rehousing to those at risk or those who have lost their housing because of the economic downturn. Next slide, please. And then I said earlier that you are going to have to document this, and you're going to have to document it in IDIS, and you can see on the screen, you're going to put it in the activity description, and you're going to document how that activity is used to prevent, prepare for, and respond to coronavirus in that activity description. And then you're going to want to maintain the adequate documentation in your program files to be sure that the date by which you're carrying things out is after your state or local government began preparing for coronavirus. And I think that's it from me. I'm going to turn it back to Norm.
Thank you so much, Brett. And the questions are coming in fast and furious, which is great. We're working on responding to them. So thank you very much. Right now, I want to turn things over to Lauren Hayes from our environmental office, and she's going to talk about some of the environmental requirements. Lauren?
Thanks, Norm. Yeah, so I just want to go over some of the changes to certain environmental review requirements as part of the ESG-CV fund. So for most activities, nothing has changed. It will be the same Part 58 environmental review process, but there are a few key changes for certain activities. I think the big one here is a statutory exemption from environmental review for temporary emergency shelters. And these have to be, again, both temporary and emergency shelters to prevent, prepare for, and respond to coronavirus. And there is a list of activities related to temporary emergency shelters in the notice that this applies to. Because of the temporary nature, this wouldn't be things like new construction, but it does apply to renovation for temporary emergency shelters, shelter operations and equipment, leasing, acquisition, services related to shelters. So that is included in the notice. And then in terms of documentation, this does not require any kind of environmental review format or documentation. There just needs to be documentation just on file for monitoring purposes saying that this activity was a temporary emergency shelter. It has been determined necessary to prevent, prepare for, and respond to coronavirus, and that you're utilizing the statutory exemption. So just document that in your file, but there's no set format for that. Then the other issue, environmental issue, is reimbursement. So the CARES Act does allow for reimbursement of activities, but an environmental review is required and a request release of funds, if applicable, prior to reimbursement of ESG funds. So what this looks like in practice is that CENST, so categorically excluded, not subject to activities, this is probably pretty easy to do and probably will be eligible for reimbursement. You just have to document a CENST environmental review and document there was no environmental harm. For other activities that may be categorically excluded subject to, so physical activities, rehab, that might be harder to document kind of after the fact. Environmental review isn't really designed to be documented after the action's already been taken, so you could run into issues with things like historic preservation and endangered species. So that will kind of be addressed on a case-by-case basis. But if you can't complete a full Part 58 review for these reimbursement activities and document that there was no environmental harm, that activity might not be eligible for reimbursement. So in general, it would work best for the ENST activities, TBRA, that kind of thing, non-physical activities. And then just another note, the environmental review should be under Part 58, not Part 50, as noted in the regs. And then there's a link here to the Office of Environment Notice on kind of imminent threats and the exemption for that related to public health emergencies. So that is another exemption that can be used to kind of streamline the process for emergencies. And there's a whole separate notice that talks about what is eligible for that exemption. And then finally, there's also a link to the Office of Environment COVID resources page. And this is just kind of information for environmental review processing in general during COVID and during times of telework. It talks about emailing the request release of funds. There's an exemption, an emergency exemption for Section 106 historic preservation consultation. So there's a 7-day kind of emergency consultation period instead of the usual 30 days. So there's information on that and some information about centralized inboxes for the public notices and submitting objections to the request release of funds. So feel free to check out those resources as well. I will turn it over to questions now because I have to hop off early. I know there was one question earlier about documentation for the temporary emergency shelter exemption, and I feel like I covered that. It doesn't have to be a specific format, just document that you are using that exemption. Let's see,
There's one question, and I think you kind of covered this, but it's about whether the environmental review has to happen prior to reimbursement, and only if it's applicable. But I think you answered that before you actually carry out the activities, if you have to do an environmental review, you have to do the environmental review before you start doing anything, certainly well before you get reimbursed, right?
Right. And in cases where there were non-physical activities done before and there wasn't an environmental review and you are seeking reimbursement, it's possible to do that after if you can document there was no environmental harm. That's trickier to do for physical activities. And then for temporary emergency shelters, those meet the exemption. You don't have to do any environmental review.
Great, thank you so much. Thank you, Lauren. So if you have a question in the next 5 minutes, Lauren will be available to answer in the chat box if you have a question about environmental review. In the meantime, we're going to move on to Ebony Rankin from the SNAP's office, and she's going to continue our run through the ESG notice. Ebony?
Thanks, Norm. Good afternoon, everybody. I'm going to talk about means for carrying out grant activities and discuss briefly the additional eligible activities. So the state and local governments could subaward to PHAs and to local redevelopment authorities. States may use up to 100% of their allocation to directly carry out activities. So they would need to specify the type and amount of activities in their substantial amendment or their action plan, and then they must document that they are designated themselves as the entity that's carrying out the activities, and then they must submit new certifications. And then we will have additional information about certifications later in this webinar. So next slide. So as those who may have already read the notice know, we have additional eligible activities listed in the NOFA, and I'll talk about each of the ones that you see on the screen here. So next slide. Okay, so the first one I'll talk about is temporary emergency shelter. So we define the temporary emergency shelter as a structure, portion of structure, and it's used for limited time because of a crisis. In particular, this crisis, and it's to provide shelter to individuals and families displaced from their normal place of residence or their normal shelter. And it's used for response to a natural disaster. The local public official must determine that the temporary emergency shelter is necessary for the coronavirus response, and it's only used for a limited period of time. So it's time limited to January 31st, 2022. But we will grant we can grant an exception with a written request by a recipient, and we do lay out the terms of the written request in the notice. It has to have why the longer period is necessary and what the planned activities are, the number of months of the extension, and a plan for connecting the participants that are going to be in the temporary emergency shelter to permanent housing afterwards. So next slide. Okay, so in addition to all the costs that we have in ESG in Rule in 576.102, there are some other eligible costs under the temporary emergency shelter. You have acquisition, and that's capped up to $2.5 million per real property. You also allow additional service, including essential services, housing search and placement, housing search and counseling, and then other shelter costs that we approve in writing. And like I said, all the additional requirements are listed in the notice. Next slide. And so here are some of the requirements, and I think we've had questions about some of the standards and requirements questions about if they apply with the temporary emergency shelter. So our minimum period of use does not apply. The requirements for environmental review do not apply. As you see, shelter habitability standards do not apply, but lead-based paint requirements do apply. Also, non-discrimination and accessibility requirements also still do apply. Next slide. So the next eligible activity is training. Funds can be used for training on infectious disease prevention and mitigation for staff and responding to coronavirus. And it's important to note that it's not considered an admin cost. So the normal 7.5 admin cap in ESG does not apply for training, and it's eligible for a standalone activity. The budget costs will go under street outreach component and IDIS under unique budget line item under street outreach and IDIS. And I think Marlisa will talk more about IDIS later in the webinar. Next slide. Hazard pay. So you can actually use funds to pay for hazard pay for recipient or your subrecipient staff. So they have to be working directly to prepare for and respond to coronavirus, along with people who are homeless and at risk of becoming homeless. So we have examples listed here of some of the staff that may be eligible for hazard pay just because of the type of work that they do. Your street outreach teams, your emergency shelter intake, maintenance and security staff, the staff that's providing essential services, and any other staff that's in proximity to persons with coronavirus or are working in locations with a high likelihood of contracting coronavirus. So next slide. Another eligible activity is our hand washing stations and portable bathrooms. So you may use funds to install and maintain hand washing stations and bathrooms in outdoor locations for people experiencing unsheltered homelessness. And we are allowing this because we all hear about it. Wear a mask, wash your hands are the two biggest things to help prevent the spread of coronavirus. So we thought this was very important to include into our notice. Next slide. Landlord incentives. So you can pay for landlord incentives that are reasonable and necessary to obtain housing. You cannot use funds to pay for more than 3 times, landlord incentives to pay for more than 3 times the rent charge for the unit. So, but we have some eligible costs here, which are sign-in bonus, that's up to 2 months of rent, security deposits up to 3 months of rent, the cost of repair damages incurred by the program participant that's not covered by the security deposit, and that were incurred while the participant was in the unit, and then the cost of cleaning and maintenance of the participant's unit or their appliances. So next slide. Volunteer incentives. We also allow ESG-CV funds to be used to pay for reasonable incentives to volunteers, and that's to provide the street outreach, emergency shelter, and essential services, and housing relocation and stability services during the outbreak. And we allow this because, you know, we know that there could be a potential for our recipients to need more people on the streets to help those who are experiencing homelessness. So next slide. Okay, Norm, that is it for the additional eligible activities.
Great, thank you so much, Ebony. And again, questions are coming in fast and furious. We are working on answering them, and if you see answers from Brett in the chat box, know that there are actually a lot of people working on those answers, and so we'll keep answering those, and we'll have a lot of time for Q&A at the end. But we do have a few more content slides we want to go through, so I'm going to turn things over to Marlisa Grogan from the SNAP's office. Marlisa?
Hi, everybody. I'm going to start with going over some broad IDIS setup information. We're working on updates to the IDIS manual for ESG, and also stay tuned for an IDIS webinar for ESG that we're going to be providing soon. Those will get into a lot more detail, but just to get you all started, here's a broad overview. So in general, your standard IDIS project and activity setup instructions remain the same. You're not going to deviate from those. And that means that there's going to be one HESG project per grant year. So for fiscal year 2020, you're going to still have just that one fiscal year 2020 project. It's going to include both your 2020 annual grant as well as the ESG-CV grant. Both of them are set up under the same project. And we also have project setup information posted on the HUD Exchange under the Grants Management tab. You can get step-by-step instructions and troubleshooting tips to set up your project. And then you're still going to stick to one activity per activity category. So that means that you should only have one activity for fiscal year 2020 for emergency shelter, street outreach, rapid rehousing, homelessness prevention, admin, and HMIS. Those are still the only activities that you set up for 2020. That remains the same. And then we went over the documentation. If you happen to be funding both COVID-related activities under your annual grant as well as just your traditional ESG activities, under that activity description on the activity page, that's where you would need to split up your narrative between the two to indicate how much money you're using of that activity from the annual grant for COVID response, and then how much of your annual funding is just going to remain the same as you had traditionally planned to use that. So that is just largely the same. And then the new eligible activities, they're going to fall under the framework that you have for that you typically have for ESG. So those are going to be charged and grouped with the existing eligible activity components in IDIS, which we will go over now. Next slide, please. So for temporary emergency shelter, this must be categorized in your activity setup as an emergency shelter. So when you're doing your record keeping, make sure that you also have records that the structure or the portion of the structure met the definition that Ebony went over, and we include an example here. So you would document that the property is typically a hotel and it's being used as a temporary emergency shelter for the period that public health officials deem that it's needed, and that it's part of your coronavirus response. So that would be a direct link to COVID. For training, that can be actually categorized under any activity category if it's part of like traditional training. However, if you're doing training above and beyond, this is not reflected in the slide, but if you're doing training above and beyond any component type related activity, so an example of that would be you're training staff that are not funded with your grant, your ESG-CV or annual ESG grant. If that's the case, you want to put it under street outreach only, and you would be reporting it out under street outreach. So that's the one caveat. If you're just doing normal training for your staff funded with ESG, you can put it under that activity category. If you're going above and beyond that training and you're training those who are not, you're training staff not funded with your ESG-CV or ESG annual grant, then you want to report it and budget it only under street outreach. For hazard pay, this is related to the staff that are paid for by your ESG grant, and so that gets categorized under the respective components, so prevention, rapid rehousing, shelter, or street outreach. And records that can help you document that would be job descriptions, policies and procedures, or other program records that detail the positions that need hazard pay, and that link that Ebony talked about to being at higher risk for contracting COVID because they're on the front lines, they're working with people directly, and so there is that increased risk. Next slide, please. Hand washing stations and portable bathrooms are categorized under street outreach, and the one caveat here is that it's also eligible technically under emergency shelter. If you have an emergency shelter and you need to beef up your sanitation procedures and you want to like add extra hand washing stations as part of the emergency shelter, that's already an eligible shelter operations activity. But if you're going above and beyond and using this new activity as part of your street outreach program, then you need to categorize it under street outreach. Landlord incentives are eligible under homelessness prevention or rapid rehousing, so they should be budgeted there. And this is similar documentation that you would typically use that costs are reasonable and appropriate. And then volunteer incentives, they are associated with your with staffing costs, so those can be eligible under any component, and you would be categorizing them under the component for which the staff are working. So if you're incentivizing volunteers for your shelter projects, then that would be budgeted under shelter. And then documentation would also include just your typical reasonable and appropriate documentation for that. Next slide, please. I'm going to run through the list of the waivers and alternative requirements that are part of the notice. And you'll see that some of these are already part of the CARES Act. Others have been extended through the extending the mega waiver, either mega waiver 1 or mega waiver 2. So some may look familiar, and then others you'll notice are new additions to the notice. The first is the emergency shelter and street outreach expenditure limit, which is waived. So you're no longer limited to the expenditures under those components. Admin costs increased from 7.5% to 10%. Recipients may pay for HMIS lead activities even if they're not an HMIS lead. So you don't have to be a lead to pay for HMIS lead costs. And HMIS costs are also expanded in the notice so that if you're doing more system-wide work that's part of COVID response, there doesn't need to be a direct link to the ESG program as there typically is per the ESG regs. The match requirements are waived, so although you can still elect to contribute match, it's not required. Recipients, and here the key here is that this flexibility does not apply to subrecipients. Recipients may deviate from federal procurement standards, and in order to do that, you do need to establish alternative written procurement standards. This is limited to recipients, so even if you as a recipient want to delegate this flexibility to your subs, you don't have the authority to do that, so subs still must follow federal procurement standards that are typically required of them. And if that is an issue and you're looking for a waiver for them, that's something that we could entertain on a case-by-case basis. The FMR limit is waived. That's a continued waiver from one of the mega waivers. And then the 24-month limit on rental assistance and supportive services costs under rapid rehousing and homelessness prevention is extended for 6 months, but there is a limited universe of households for which this applies. It's for those who reach their 24-month maximum between the period of January 21st, 2020 and February 28th, 2021. So if they reach 24 months between January and February of next year, then you can provide them an additional 6 months of either rental assistance or supportive services. Monthly case management is waived. This is not really a new waiver, but it's clarifying that the CARES Act prohibition for requiring any prerequisite activities or treatment or testing or anything basically that you need to provide low barrier assistance, that also applies to monthly case management. So that cannot be required as a prerequisite for providing ESG assistance. Next slide, please. This slide is entirely dealing with hotel and motel costs. The costs may include renting a hotel or motel room directly or through a hotel or motel voucher. Both methods are eligible. These costs can also include cleaning of hotel or motel rooms used by program participants, as well as repairs for damage caused by program participants, and that's above normal wear and tear of the room. The costs can be provided to these household types, which is definitely an extension of what's typically eligible under ESG. They include those experiencing homelessness, households receiving rapid rehousing assistance under the COC or ESG programs, receiving homelessness prevention under the ESG program, or residing in PSH. So any households that fall within those categories may be provided hotel or motel costs as part of COVID response, which of course are really important to provide spaces for isolation or quarantine as needed. Next slide, please. Program income, the definition has been adjusted mainly because it's no longer required to be used as match. Because there's no matching requirement, the program income is not required to be used as match. Instead, it may be treated as an addition to the recipients, or if it's the subrecipient's project that generates program income, it would be the subrecipient's subaward, or it could be otherwise deducted from allowable costs. And the new definition is it's exactly what's provided in Part 200, 2 CFR 200.80, except that program income also includes any amount of a security deposit or utility deposit returned to the recipient or subrecipient, and costs that are incidental to generating PI and not charged to the ESG grant, or the subgrant can be deducted from gross income to be able to calculate PI. Just a brief note on security deposits or utility deposits. ESG, we don't require that recipients or providers track down security deposits or utility deposits or try to intercept them if landlords do repay them to the program participant. So we recognize that is largely an administrative challenge. So this reference is just meant to indicate to you that if you receive security deposits or utility deposits in any amount, then that's what we would consider program income. Next slide, please. And then these alternative requirements are really where the limitations that Brett initially mentioned come in. The medium-term rental assistance definition in the ESG regs is typically was 3 to 24 months. That still is the case for any annual ESG funds that are used, but it's now limited to 3 to 12 months for any ESG-CV funds that are used where your substantial amendment or annual action plan has been completed and reviewed by the field office after September 1st, 2020. And then the other limitation is to emergency shelter activities. There's a time limit to January 31st, 2022. And then as mentioned before, providers cannot require treatment or any prerequisite activities as a condition for receiving ESG assistance, including case management. Next slide, please. So recognizing that this is a pretty significant departure for medium-term rental assistance, we do want to offer some initial thoughts and considerations as you plan out your projects, that the focus is on resolving the current housing crisis first. So remember the full scope of rapid rehousing, including housing identification, rent and move-in assistance, and rapid rehousing case management and services. So we recognize that the time limit is reduced, and remember to prioritize client choice within housing identification. And then provide trauma-informed services. So the experience of becoming homeless and the transition back can be traumatic, and then you add in the additional stressors just related to COVID, it makes trauma-informed assistance that much more important. So focus on what the client needs now to stabilize as a priority, and then also prioritize connecting to community resources. That's really important, including support from behavioral health and other needs specific to the individual or family that you're assisting. Next slide, please. And then post-stabilization, think about client-directed conversations about goal setting. So additional consideration and prioritization for transition planning, thinking through employment benefits to try to increase monthly income, so that assistance, to the extent that you can provide effective assistance within the 12-month period, those are ways to try to make your assistance more impactful. And don't assume that high acuity clients will need a transition to a longer-term subsidy or deeper interventions. As I'm sure you all are thinking through as you're planning out your written standards and how you're going to designate lengths of your assistance. If clients have a need for ongoing support, then the administrative burden is carried by the staff and not the participant, as a way to try to identify client needs in a more effective way. And then the other thing that's not here but is really important to recognize is that there are other funding sources out there, like the Coronavirus Relief Fund, CDBG-CV. So think about those other resources, the home program, tenant-based rental assistance, so that you're thinking creatively about ways that you can braid together different funding sources. Next slide, please. There is a grace period for coming into compliance with coordinated entry, written standards, and HMIS requirements. And this can be confusing because the grace period actually ended June 30th, 2020. So we're going to go through the timing of this and give just a brief example to try to give you an idea of where we're headed with this. So the universe of eligible costs are incurred for new activities. So these would be new activities that are allowed by the notice that were incurred between January 21st, 2020 through January 30th, 2020. And the idea is that especially when you're looking back for costs that are eligible under the ESG notice, but that, when you're providing them as part of coronavirus response, way back in January, if that's when your community started your COVID response, you're not necessarily thinking about ESG requirements. And so recognizing that it's going to take time for those projects to be plugged into coordinated entry, to adjust written standards, to make sure that that you're changing your prioritization to account for high-risk populations more susceptible to COVID infection, and then also participating in HMIS. We're trying here to account for the lag between the period when these costs are being incurred and when you actually recognize, okay, we want to use ESG. We want this to be part of our ESG program, and so it's to account for the time that it took to make that transition for basically bringing those activities that in many cases are new into the framework of your ESG program. So from July 1st onwards, the expectation is that coordinated entry, written standards, and HMIS requirements are applicable and that they are being complied with. So so at that point, that's when we expect that those activities are then brought into the framework of the ESG program, and you're starting to report you're starting to integrate them into your coordinated entry system. So an example is a coronavirus response activity. Let's say it is landlord incentives that you started in February when your project started, when your community started responding to COVID. Since that activity, which started in February, is within this time frame, you have 60 days for that program or for that activity to come into compliance. I think some people are getting hung up on the deadline. So let's say you had an activity that started June 1st. You would have a 30-day grace period. You wouldn't get the full 60 days. You would have a 30-day grace period for having come into compliance with the coordinated entry, written standards, and HMIS requirements. And we can run through additional examples as you come up with them. And then we're going to end the presentation and move on to Q&A, but before we do, we're going to just go over the certification requirements. To boil it down, there are two areas where the certifications that you submit as part of your substantial amendment or action plan, two areas that are affected: match and the minimum period of use requirements. So match is not required, and so any match certification that's submitted, it's not valid with respect to those funds. If you've already submitted your certifications, your certs, then even if you made a mistake and you certified that you're going to meet match requirements, in any case, HUD cannot require that. So even if you certify that you're going to meet match, it's not valid with respect to those funds. And you get that cover in the ESG-CV notice. And the same goes for the period of use. That is not required for temporary emergency shelters. So even if you were to certify that you will meet the minimum period of use requirements per the notice, that certification is not valid. So this is just to say, even if you submitted the wrong certs and you certified to these two things, you're not held to it. Next slide, please. So you all are probably very familiar that there are a number of different versions of the certifications floating around. There are the annual ESG certifications that have been posted on the HUD Exchange that you've been using for years, and those are still valid for annual ESG funds. And then we also posted interim ESG certifications. If you already submitted those as part of your substantial amendment, that is completely fine, and you do not need to resubmit them unless you're a state that wants to exercise the flexibility to carry out activities directly. So if you've submitted a substantial amendment for both round 1 and round 2, you submitted your interim certs, you're completely fine. Unless you're a state and you want to exercise that new flexibility, then you're going to have to resubmit with the updated ESG certifications. So the updated ESG-CV certifications are included as in an appendix to the notice that are posted on the HUD Exchange along with the notice. If you have not yet submitted your substantial amendment or annual action plan, use these updated certifications, especially if you are a state that wants to use the flexibilities. And the one other thing is that if you are using your annual funds for COVID response, then you also want to update your certs with the new updated ESG-CV certifications. And then next slide, please. We're just going to break this down between the states and the non-states for annual certs. Again, you need to submit the certs in Appendix 2 for each annual grant, and that's when you want to exercise the flexibility. Then for non-states, you're encouraged but not required to submit the certs in Appendix 3 for each annual grant when you're using annual grants for COVID response. And the next slide, please. This is just to let you all know that we are working on guidance on duplication of benefits, quarterly reporting and SAGE. The trainings have been ongoing for the last 2 weeks, so if you haven't been tuning into those, please check the HUD Exchange to be able to review them. And then we will also be presenting IDIS program setup guidance for ESG in webinar form in the upcoming weeks. And then just we're constantly posting things, so please keep checking the HUD Exchange for additional updates as we're available to provide them. With that, I'm going to turn it back to you, Norm.
Great. Thank you so much, Marlisa, and congratulations on getting through a ton of content there very efficiently. We have a ton of questions. I'm going to start with some of the ones that I think were sort of commonly asked and a little thorny. I'm going to start with, we had a couple questions about tracking racial equity outcomes and what is the expectation for data and tracking on racial equity outcomes. Excuse me. So the most common things that people are tracking are things like housing placements. You know, especially as you're ramping up rehousing efforts, to be able to track housing placements and the success rate of housing placements. So of the people you serve, what percentage get housed? And people are also tracking what percentage return to homelessness. Some of this is automatically done in HMIS already. So if you're entering data into HMIS, you're actually tracking a lot of outcomes on racial equity. I think the key message we want to send, though, is that often tracking outcomes helps drive the performance and the way different actors focus their efforts. And so I think it's really helpful to track as close to real time as you can. What are your housing placement rates by different racial groups, so you can see if you have disparities there and whether you are closing disparities. So that's the one I would certainly recommend. But also know that if you've used Stella or you've looked at your data in other ways, a lot of that is already being tracked just by virtue of putting stuff into HMIS. Also, outcome tracking, the great thing to do is to use some of the work you've done on improving your governance and making it more focused on racial equity, and talk to people and ask them what would be good things to track and things they think would help improve things in your community. I want to talk through we had some questions about acquiring temporary emergency shelter. And so the questions ranged from why can we only acquire temporary emergency shelter and not permanent ones? And what do we do with the temporary emergency shelter once sort of January 31st, 2022 comes along? So I want to just sort of address this. First of all, the goal of the temporary emergency shelter and the ability to acquire temporary emergency shelter was an understanding that it was is still an emergency and we needed to do things quickly, and often that involved things that wouldn't normally pass habitability requirements, but public health officials knew that they were still necessary. So this might include things like creating, and again, this a lot depends on sort of the climate and where you are, but using things like tent structures or non-permanent structures for temporary emergency shelter, again, to help with the public health emergency. So those are typically not things that you would think of as permanent structures where they could be permanent emergency shelter. However, we also know that some people are doing things like purchasing hotels or purchasing buildings that they are planning to use as temporary emergency shelter, but that could theoretically serve as long-term shelter. So, and that's doable. So if you purchase a property or acquire a property or rehab a property to use as temporary emergency shelter, you have to make sure that it is actually being used as temporary emergency shelter. So you should look at the definition of temporary emergency shelter in the notice. You'll see that it's a structure that's intended to, be used to address a pandemic or disaster. And then you can use ESG funds to operate that as well. After the pandemic is over, you may still have a building, and it's not like you can't use that as a long-term emergency shelter, but you have to have used it as a temporary emergency shelter in both the spirit and the letter of the requirements. And you can, if you're using ESG-CV funds, you can't use those past that January 31st, 2022 deadline. So hopefully that provides a little more information. We're working on a little more documentation and information about that. We had some questions about landlord incentives and the action plan. Marlisa, I want to throw this question over to you. So the question people had is, if you have already did your amendment and you want to take advantage of the landlord incentives, but you didn't put it in the amendment because you didn't know that that was an option, do you have to, how does that work? Do you have to amend that to add landlord incentives, or how does that work?
So in IDIS, we don't get to that level of detail. So you'd be budgeting your landlord incentives under rapid rehousing or homelessness prevention. And in IDIS, you're setting up an activity that broadly encompasses all of your rapid rehousing or homelessness prevention activities. If you're adding additional funding, then it depends on the scope of your, how you define a substantial amendment in your citizen participation plan. So if you're adding a lot of money, then that may trigger a substantial amendment. But otherwise, it's just included under your current budget. If you don't need to make any sort of budgeting changes, I think a best practice would be just including in your activity description that you're also planning to do landlord incentives, but you're not setting it up as a separate activity, and you don't necessarily have to even include it in your substantial amendment or your annual action plan as part of the project description, as long as you have the category for rapid rehousing or homelessness prevention included, you should be covered.
So just to recap what might be a common scenario, I submitted my amendment, I have gone to grant agreement, I set up a rapid rehousing program, for example, and now I see that we can do landlord incentives, and I realize that would be really helpful. I can just start spending that money on landlord incentives. I don't actually have to do anything additional to execute that, and then where do I charge that activity?
You can charge it as an overhead cost to rapid rehousing or homelessness prevention. It doesn't, you wouldn't be putting it as like a rental assistance cost per se, because there are some costs that if you're paying for like cleaning or damages or something like that, you can just consider it an overhead cost.
Great, thank you very much. So we have a few questions about coordinated entry. I'm going to try to reframe this coordinated entry HMIS and this weird waiver of a period that has already passed. Because I think that's confusing even as we think back to it. So what we were trying to accomplish there is that we knew people, especially in the early days of COVID, were just trying to get things up and running. And sometimes it was hard to meet those all the requirements, including coordinated entry and HMIS, right away. And, we understand that. And so, normally what would happen is we'd go back, and when we monitor everything, we see you're out of compliance, we, might issue a finding or whatever and, say address it in the future. But given that it was, potentially a fairly common occurrence, we just wanted to give like I don't know if this is the right way to say it, but a retroactive get out of jail free card on that topic. So that's, that's why we wrote it that way, and that's why it's so strange to have that. It's just that we understand that it was hard and people were struggling to get things going and to, meet the demands in front of them. And we just wanted to, sort of give you a reprieve on that. So that was the goal there, and that's why it kind of looks so funny. I will say we also started writing this notice well before June 30th. So anyway, that's all I'll say about that. So we have some questions about the other sort of big question I want to talk about is about prevention assistance. So the first thing I want to say is I know that CDC put out a moratorium on evictions going forward. I don't we're still trying to figure out the interaction between that and the ESG notice. So I can't really speak to that quite yet. And we'll have more information coming up in the coming days and weeks. But we get a lot of questions about how can you do homelessness prevention if there's a eviction moratorium. I will say that we actually have a lot of materials. We did a whole webinar on homelessness prevention, and I strongly encourage people to go back to that. But a couple things. One is that a lot of people get evicted that are not covered even under the CDC eviction moratorium, and we know that actually most people who become homeless don't come straight from an eviction scenario. We encourage people to look at all the various ways people are becoming homeless right now, because there certainly are many of them, and encourage you to, if you're going to do homelessness prevention, to think about how you can do that. We also put out some information about how to work with people in advance of an eviction moratorium ending, to be sure that they don't sort of become homeless as soon as the eviction moratorium happens. So please, we'll try to, hopefully maybe we can sort of come up with the links to those resources and post them in the chat box. There are actually a lot of circumstances and a lot of ways to use homelessness prevention resources, even under an eviction moratorium. So I encourage you to look, and just like that, Brett managed to find it and put it up. So I encourage you to look at those resources, and I think that sort of explains some of the state of state of play here. And again, we're still looking through the CDC eviction moratorium and trying to understand the interaction between ESG and the eviction moratorium. Okay, so going through other questions here. So the 240 days, the obligation deadline, Brett, can you talk about, is it 240 days for both obligations, or like, so if you have an you executed your CARES Act 1 on, say, July 1st and your CARES Act 2 on September 1st, do they have separate deadlines? How does that work?
Yep, it's going to be one obligation deadline starting from the date that HUD signs the grant agreement. So, yeah, so one deadline covers both. So that might mean for the second allocation, depending on when your grant agreement got signed, you have a little bit less time than 240 days.
Great, thank you. And we have a question about documentation for prevent, prepare for, and respond to coronavirus. So can you talk about what documentation, or when can people start charging costs, and what documentation is going to be required, especially for those early days when people were first responding to coronavirus?
Yeah, you can start incurring costs or reimbursing yourself for costs going back to the date that your community started preventing, preparing for, and responding to coronavirus. Now that's going to be different for every place across the country, but it shouldn't be earlier than January 21st. And what we expect for you to document, you're going to have to really look at two things. One is the activity in and of itself eligible in terms of preventing, preparing for, and responding to coronavirus. And that goes back to the definitions that I covered. And then two, documentation about when your state or local government began preparing for coronavirus. This could include formal, like agendas from formal meetings or planning calls. It could include notes. It could include, you could like screenshot a meeting notice that you had with your state or local government about what they were doing to prevent or prepare for it. It could include maybe when you had a local health order go into effect. There are several ways that you can do it, so whatever you can get your hands on locally.
Great, thank you. We have a question that just came up in the chat box that I want to talk about, and mostly say that we're working on some stuff in the future, but the question is about, can ESG-CV funds be coordinated with COC rapid rehousing funds in a way that would allow flexibility to do more than 12 months of rental assistance if it happens to be necessary? So that is a great question. We are working on some different bits of information to share with people about different ways to use funding sources together, not just COC rapid rehousing, but the Coronavirus Relief Fund from Department of Treasury and CDBG and local rental assistance and other sources. I will say a couple things about this, though, that if you set up a project that has both, if you set up a project that has, say, ESG-CV funds and, I don't know, like coronavirus relief funds, and you have contracted for the same project for both of those, for a project to receive both those sources of funding, it's part of the same contract. You can actually, as long as you're not double paying for something, you can actually use those sources of funding together. So, for example, first use the Coronavirus Relief Fund and then use ESG-CV funding for rental assistance. That's certainly allowable. Another thing is, while rental assistance in ESG-CV is limited to 12 months, its participation in a rapid rehousing program is not limited to 12 months. So, for example, if you if you enroll someone in a rapid rehousing program and you're not providing them with ESG assistance yet, you're providing them with other assistance, and later, even if they've been housed for 6 months, maybe you're using other resources, maybe CDBG or something like that, and then you realize you're going to need ESG rental assistance, ESG-CV rental assistance, then you can start using ESG-CV rental assistance. The key is that you sort of had ESG, they were enrolled in ESG the whole time. So that's as opposed to a situation where someone was in a rapid rehousing program funded by, say, CDBG or coronavirus relief funds, and then later you exited them out of that program and then try to enter them into a ESG rapid rehousing program. So in that case, the person is housed, so they're not really eligible when they come into that ESG-CV rapid rehousing program. But if you just enrolled them in the ESG-CV rapid rehousing program and you were providing assistance and then later wanted to provide ESG rental assistance, you'd have 12 months from that period of time. So if that all sounds very confusing, we are working on some information that will help make that seem much clearer. So let's see what other questions we have. Let's see, sorry, every time I answer questions, I forget to look up the next questions. We have a question about whether CARES funding can be used for arrears. Ebony, I wonder if you could talk about whether you can use ESG-CV funds for rental arrears, utility arrears, for how long, and what are the conditions there?
Yes, so you can use ESG-CV funds for arrears and any other costs besides those that are, that are changed via either waivers or alternative requirements under ESG regs. So you would just use the ESG regulations for the arrears. I think it's 6 months. So.
Great, thank you. We had some questions. We had some interesting questions about use of hotels and motels. Can you talk about, Marlisa, can you talk about, so if you have a rapid rehousing program, so after you've enrolled them in the rapid rehousing program, but maybe you haven't housed them yet, can you use that program's funds to keep them in a hotel room for a period of time until you find housing?
So hotels and motels are not eligible under the rapid rehousing component. So this is where some, just flexibility in the way that you're designing your ESG program would be really helpful. So it would be eligible under emergency shelter. So to the extent that you could coordinate between an emergency shelter that could fund the hotel or motel vouchers, or you could also have a standalone hotel-motel project, that would also be a way that you can provide hotel or motel vouchers for COVID response, which would also include the eligible households from rapid rehousing or PSH if they're housed, or if they need to be housed just prior to a unit opening up for a rapid rehousing program participant. That would all be a way to do that.
And then if you rehoused someone, say a family of like 5 and one individual contracted coronavirus and so they had to be isolated, could you then pay for a hotel room for that person? And then how could you pay for that hotel room?
Yes, that is exactly the intended use for the expanded eligibility for hotel and motel costs. So if you're not running your hotel or motel project in coordination with an emergency shelter, so you don't have an emergency shelter provider that's coordinating the hotel or motel placements, you could have, and I think that this is fairly common in more rural areas where you don't have emergency shelter facilities readily available, you can do like a standalone hotel motel project. And so it would just mean coordination between a rapid rehousing provider, or you could even fund a rapid rehousing provider with emergency shelter funds.
Great, thank you. We had a question, Ebony, I wonder if you could talk about this. We had a question about, do arrears count towards the 12-month rental assistance limitation?
Oh, we had that question a lot. No, I do not think it counts toward the 12 months rapid rehousing limitation.
So you can theoretically pay for 6 months of rental arrears and 12 months going forward of rental assistance. Again, subject to all the various different things we've talked about. Thank you.
Right.
Ebony, we also had a question about landlord incentives. Are they eligible for street outreach programs and emergency shelters as well, or is it just for rapid rehousing or prevention?
So landlord incentives are eligible under all the components. So you can put it under. You can also put it under the others too as well.
Great. Brett, we have a couple questions about hazard pay. Can you talk about the standard for hazard pay? Like, how much can you pay people? And is it only for people working in ESG-funded projects, or can you, do it some other way? But can you pay for people who are like part of homeless assistance programs that are not getting ESG funding?
Yep. So I think a couple things that I just want to start off with. While we have the ESG-CV notice, it's also important to remember that the ESG program rule also applies unless we've added any flexibilities, and 2 CFR 200 also applies. And so hazard pay is only eligible under the ESG-CV notice for recipient and subrecipient staff who are working directly to prevent, prepare for, and respond to coronavirus. And then 2 CFR 200 has some additional requirements about hazard pay that I don't know off the top of my head, but I'll look up and I can paste it in the chat. But you generally have to have policies and procedures around it. They still have to be reasonable and appropriate, and you have to keep those policies on file.
Great, thank you. So we have, Brett, staying with you, we have a couple questions about case management. So can you sort of address, one of the questions is about, so the recipients are prohibited from requiring case management. Does that also apply to subrecipients? Can a subrecipient require monthly case management from people participating in their rapid rehousing programs?
Well, that's just a trick question. The CARES Act in general, the CARES Act actually prohibits a recipient or subrecipient from requiring anybody who's been experiencing homelessness from participating in treatment or services as a condition of receiving housing or shelter. So no, nobody can require program participants to participate in case management.
Okay.
Obviously, we encourage you to provide services. You should be reaching out. You should be engaging your clients, but you can't require them to participate.
Great, thank you. We have another question, and I can take this one, about sort of the tension between, well, if you don't require case management, but you're supposed to help people, like work on self-sufficiency and provide additional services for them, how does that work? This is obviously way bigger than just the content of this webinar, and I think we had some people who posted some links in the chat box for different resources for this. I will say the prohibition on requiring case management is actually part of the CARES Act, so it is not something we have any discretion over. That said, we have a lot of projects that don't require case management and other services. And we, I think recipients and people running those projects have been very successful at managing this tension. Again, there's a lot of focus on motivational interviewing and other sort of techniques to better engage clients, really working with people on their self-identified goals, the things that they're interested in, making sure that your case managers are, reflective of the population you're serving, the people you're serving are comfortable with your case managers and feel like there's real value to the case management. So we do have some resources on the HUD Exchange. We'll try to, again, see if we can post some of those in the chat box. But this is not something we can waive. And but that said, we have a lot of projects that we fund through the COC program, for example, that use this approach, and I think overall very effectively, and would love to hear from others who can type in the chat box if their programs use this approach and if they have any thoughts about it. So we have a question about program income of under $25,000 and whether we can, what documentation we're required to keep for program income under $25,000. Marlisa, I'm going to turn this one over to you. I honestly don't know the answer to this. Can you talk about what the requirements are regarding program income, even in small amounts?
We are working this out. We typically the financial reporting, the SF 425 is not required for ESG because information is all required information is already captured in IDIS. The notice does change that up a little bit, so we're just taking a closer look at financial reporting and making sure that everyone's covered with info that's in IDIS. So please stay tuned for more information on that.
Great, thank you. So we have a question, another question about hazard pay, only for, I think we actually addressed the question about using it for other non-recipients and subrecipients. Let's see, what other questions? The clarification about the match requirements for regular ESG funding. We're not talking about ESG-CV funding. Brad, can you talk about when, or actually Ebony, can you talk about when the match requirement is in play for regular ESG funding and when they may be able to waive match requirement for ESG funding? Maybe on mute. Oh, thank you.
Hello. Oh. So I know that they're waived for ESG-CV, and then they're waived for ESG funds if they're used to plan and prepare for coronavirus. I don't know if Brett want to add any more to that.
Nope, you got it.
Okay.
Great. So we're coming to the end of our time, so I'm going to wrap up really quickly. First of all, I know there's a way to download the chat here. I wonder if someone could just put a quick note in the chat box about how you can download all the chat, because I know people will want to be able to sort of grab all that information. We will post it with the webinar, but I know people may want to get that now. So I don't know if Tommy, Joe, or Natalie, if you can just post some quick instructions for how to do that right now. I want to thank Ebony and Brett and Marlisa, and also thank Lauren for contributing as well. So I want to thank you all for joining and providing all this information. I just also want to give a huge thanks to Marlisa, Brett, and Ebony. They worked incredibly hard over many, many months to work through some unbelievably thorny issues to get this notice to publication, and they just deserve a ton of credit for doing this. So thank you all for doing this. We will continue to provide more information about the notice and about other things as they come up. We will announce future webinars on this topic. We will also address as much of this as we can during our office hours sessions. We will also use the questions you've asked to try and put together some FAQs and other information. And again, I want to thank you guys for the incredible work you're doing. This is not easy, and everyone is really, really tired. But you know, you just keep going at it, and so I just want to thank you so much. I know that we are supporting you and thinking of you every day and trying to make things easier for you. So thank you so much, and that concludes the webinar.